Hi guys, this is Anna and I'm here with Dr. Nielsen. I wanted to have an opportunity to answer a few of your questions. Without further ado.
Thank you, Anna, for having me, and thank you everyone for giving me your time and ears to listen. I just want to give a brief introduction to who I am. So I'm Dr. Nielsen. I'm a homeopathic doctor and I've been practicing homeopathic medicine for 14 years. We're going to cover what homeopathic medicine is. I believe there's going to be some questions we're going to answer, so we're going to cover that. And what I do basically every day is help a lot of females with different health concerns. My primary focus is actually endometriosis, so I actually do keynote lectures. I'm working on a textbook for healthcare professionals, and then after I'm done publishing that one, there's going to be a book for helping women like yourself who are struggling with endometriosis kind of take charge and lead your own health, as well as find the right people to help you out. So let's get it started.
All right, sounds good. Okay, so the first question will be, why did you become interested in women's health and specifically endometriosis?
Well, so the reason why I got interested in women's health is my training initially was in pediatric gastroenterology, so pediatric digestive issues. And I treated a lot of kids at one point in my career. And a lot of moms would be coming in with different health issues, like different menstrual issues, so PMS or bad painful cramps. And they would have, friends or family members who'd have really severe menstrual cramps, and they would keep being dismissed or ignored or getting the wrong treatments. And as time progressed, I just got more and more interested in that. So the last 7 years, I've been really dedicating a lot of my practice and research and time to learning more about endometriosis from a medical standpoint, but also learning more about how we can identify it so we can share that information with people. Because as you know yourself, it took a while for you to get that diagnosis. Until then, it was kind of like everyone's looking at you with a unique vision and you're not sure about how you're feeling.
Yeah. The second question will be, what has been your involvement in the endometriosis community?
Well, I haven't had a lot of opportunity to get involved directly with patients. A lot of my focus in the last 3 years especially has been more in terms of trying to get healthcare providers to be more aware of endometriosis. Fortunately, we have yourself doing a lot of great work, a lot of groundwork with your sisters for endometriosis, with your family and friends, and promoting that. And I think that's important. I think it's important in the medical side that I help educate my colleagues, whether it's in traditional medicine or alternative medicine, to understand that endometriosis isn't this unique picture of a certain small characterization of patients, but it's actually a lot larger patient group. We talked about this in one of your appointments. The 10 to 15% remark of the population being affected with endometriosis, I personally think it's a lot higher, and I think in a decade we're going to see a significant increase in that. It wouldn't surprise me if we get up to 20-30% of females having endometriosis. I think it's drastically underestimated. My community involvement has been more on the medical side. So last year I had 5 international conferences where I talked about endometriosis. One of them was at a gynecology conference. So it's really building awareness, but also on top of that, opening the doors towards alternative treatments that are effective and safe, that you can also use if you need to with prescription medication. So really educating everyone.
The other question would be, can homeopathic medicine help in managing an endometriosis pain and in reducing endometriosis? And if so, how? And is it focused on the pelvic pain, or it can also alleviate other symptoms?
Well, I'm gonna, if it's okay, if you don't mind sharing.
Yeah, sure.
What's been your experience with?
It's been great. It wasn't right away. But for sure, it has changed drastically, especially with the bowels. I used to have the sciatic pain, and that was reduced. My back pain is almost gone for sure.
Awesome.
And
Yeah, no, and thank you for sharing that. Because again, it's, as I always tell people, it's good to hear from someone who has to live with this every day, right? I'm a male, so I definitely can't experience any of this. So thank you for being open and willing to share your experience. With endometriosis, there's definitely different types of pain, as you expressed, right? There's not just the cramping, not just the backaches, but you get the bowel involvements. Yes. You also get the abdominal bloating, the constipation, the IBS symptoms. And so with endometriosis and homeopathy, it actually does help with a lot of the systemic things. So it's not just the pelvic pain, but it can help you with the bowels, it can help you with also the low energy, the fatigue, all of those things. And as your pain lessens, as you're able to improve the quality of pain, you bring it down, the ability to have more energy goes up. I mean, it's just natural. If you think about it in the past, when you still have concerns with your menstrual cycle, and a lot of females do, But if you're at a 12 out of 10 and a guy goes down to 8, and we can get that down to 6 and 4, and you're at a 4, that frees up so much more resources in your body to be enjoying your daily life.
Definitely.
So with homeopathic medicines, we can definitely help the pain. We can definitely improve the quality of life. There's a research paper that was published about 2 years ago on homeopathy and specifically on homeopathic medicines and treating endometriosis, and it showed that it had a very quick outcome in about 3 months, reducing pain by about 30-40%, which is substantial. And I would say if you could make that into prescription medication, that would be like the number one.
I agree.
Number one treatment.
Definitely.
In terms of leaving out of this, in terms of helping other symptoms, I mean, hands down, we can help with bowel symptoms. We can help with pelvic symptoms, so that also involves intimacy, discomfort with that. So that's quite a common characteristic. Another thing that's not talked about as much is bladder symptoms. You know, that burning urination, that low-grade feeling like you have a bladder infection.
Yeah.
That also we help a lot of endometriosis patients overcome as well, if they have it.
Okay, yeah. I also had that question before. Thanks for answering. Are they all the same, the treatment, the homeopathic treatment for every patient, or they're different per patient?
That's a great question. They're very different for a lot of patients, and the reason is endometriosis is very unique for each one, right?
Mm-hmm.
You know, you have some women who have really severe symptoms where it consumes their entire life, and then you have other women leading to their period, the PMS phase, and their period where it really hurts them,
Mm-hmm.
and then they're so. So we really customize it. So if you have bowel symptoms and you have pelvic pain, that's a different treatment than if you have pelvic pain and bladder symptoms.
Yeah.
Now there are some base medicines that you can use for certain symptoms. So for example, like a general endometriosis medicine that all of my endometriosis patients will get is pulsatilla and sepia. You'll see that with every one of my prescriptions that I give. And those are balancing hormones. But in general, for yourself and for other patients I treat, it is highly customized for that. When it comes to like the nutraceuticals, the supplements, there's some base supplements like the resveratrol, the NEC, that benefits a lot of endometriosis patients, irrespective of what symptoms they have. So there's a little bit of diversity, but a lot of the reason why I get amazing results is because I really focus it on your needs today.
Okay.
And if, let's say we have another patient with endometriosis, it's going to be specific to her needs. So if she has a lot of stress, then we have to address that while we address the hormones.
Great. What vitamins and supplements do you recommend taking?
With vitamins and supplements, I always tell people the healthier you eat, the better you're going to be.
Yeah.
and with diet, I believe we're going to talk about that later.
Yes.
And you can probably talk about that more than I can because you do a better job at your lifestyle. When it comes to supplements, it's simplicity. So, you know, do you need a multivitamin? Not really, to be honest with you, because I don't put a lot of people on multivitamins. If you're eating generally balanced, you're good. In terms of endometriosis, there's three supplements that I really like that are generally safe to use for anyone. NEC, so NAC, right? And that actually helps with inflammation and it helps with pain. Then the resveratrol, which actually helps you regulate your hormones, but it helps you reduce the clotting in the heavy periods.
Okay.
And then the other one that I use if you are on birth control, and even if you're not on it, but typically works better if you're on birth control, is piconol or piconol. And this one actually helps alleviate some of the pain. So there's a lot of things you can do on your own, but when it comes to lifestyle, that's pretty much where you need a little, you can start that on your own. When it comes to treatment, you can look at NEC, resveratrol, sepia, pulsatilla, all of these different things, and you can try them out, but you're going to get a better result if you have someone who is experienced in that, because let's face it, it's so complicated that if traditional medicine is kind of struggling with it, going, throwing darts across the board and saying, well, try this prescription. And then you're coming back and you're like, that really got worse. Well, we'll try this one. Those are my three that I recommend in general.
Is sleep important for managing endometriosis?
Yes. Sleep is important for everything. Sleep is extremely important simply because it helps you regenerate your tissues. So when you fall asleep and you're getting restful sleep, that's when your body's going to start healing.
Okay.
Right? So think of it like exercising.
That's also if it's important. If it's gonna cure it.
Oh, is that a question too?
Yeah.
Oh, okay. I can answer that now.
Yeah, sure.
Well, exercise is not going to cure it, but it's definitely going to help your quality of life.
Okay.
I think you can vouch for that.
Yes.
You know, you eat extremely healthy. You keep an active lifestyle,
Mm-hmm.
and those contribute to what we're doing together for your treatment to be more effective. So, exercise and diet definitely are your templates. So look at that as your starting point, because if that's wrong, then you can't expect everything else to be good.
Okay. I do get a lot of questions saying that because of the pain, they can't exercise.
Yes. So in that case, you want to get that pain managed, right? Before. So it's kind of integrating that treatment with what we do here, right?
Yeah.
You know, so when I mentioned earlier about birth control, you know, a lot of people when they come in, they're like, depending on their situation, sometimes that birth control is the right fit.
Mm-hmm.
For a vast majority of endometriosis patients who are more severe, so, you know, stage 3 or stage 4, or if they're really sensitive to hormones, those birth control pills don't do anything really. And it's not because they're not effective, it's just it's not the right fit for that individual.
Okay.
And so we can talk about that a little bit more.
Sounds good. Stress. You talked about you briefly talked about stress. So if you live a stressful life, would it make the endometriosis worse?
Definitely.
Okay.
It definitely does. What's interesting about stress is that it's the past events of stress that actually plays a bigger role in the development of endometriosis. So if you've had a lot of stress at a very young age or traumatic events, there seems to be a lot more stronger evidence that will impact your ability to deal. That impacts your progression of endometriosis.
Mm-hmm.
I think stress acutely affects all of us. And if it doesn't, you need to talk to me about your tricks.
Yeah. How important is food? And your thoughts on the endo diet, the anti-inflammatory diet, and do I need to become completely vegan?
So the diet part is where I think it gets very interesting, because there's so many different diets out there for endo, right? And I think the endo diet is actually a really good one. I think the anti-inflammatory diet is also a good one. I think vegan is a little bit. It's not that it's wrong, because there's no such thing as wrong. But I think the vegan diet limits your ability to get some of the nutrients. So you need folate and B12, and you need some of the other nutrients that you may not get as a vegan, and that can really impact the way your endometriosis is happening internally. So when it comes to diet, I prefer a more balanced diet. So, you know, if you're going to be eating, if you're looking for a diet, one of the things you can do is a high fiber diet for 3 months.
Okay.
So if you do a very high fiber diet, so that's about 20-30 grams of fiber a day, which is quite a bit.
Yeah.
So if you're a vegan, enjoy all the broccoli possible, and that's going to be a lot. So usually with diet, it is going to make a difference in your outcome, because the more you eat processed, the more you eat unhealthy foods, that's going to create an environment where the inflammation goes. But also what a lot of people don't realize is the foods you put in, that stimulates your bacterial flora growth. So the reason why we have kombucha and yogurt and all those really good probiotics that we can buy naturally is because they help reorganize our body. Those bacteria in our guts actually play a role with how we metabolize estrogen, so how we break down estrogen.
Okay.
So if you're eating fast food or you're not eating a balanced diet, you're going to have a bacteria that now doesn't break down the estrogen very effectively, so this estrogen goes more in your body, and then you get more endometriotic implants, so you get more endometriosis symptoms. If you do a high fiber diet for a 3-month period, what happens is that fiber helps improve a group of bacteria, which helps break down the estrogen even more effectively, helping reduce your estrogen levels, which is really the primary thing with endometriosis, right?
Yeah, reduce estrogen, yeah.
Reduce estrogen, and that helps reduce inflammation. So, you know, I think a high fiber diet. The endo diet, I love. The vegan diet, if it's right for you, by all means do it. The only concern I have there is the folate and B12. A lot of people will be like, well, you can supplementate with that. You can't beat Mother Nature.
Yeah.
You can't. So the more whole foods you have, the healthier you're going to be.
Do you recommend kind of changing your diet right away, or do it progressively?
I'm a progressive type.
Okay.
Because, and this is again just my personal viewpoint. Everyone is very different when it comes to diet.
Yeah.
So my saying on that is, If you are the type that can live a lifestyle that's like, you can just switch it and go, I'm dedicated to this, I'm not doing it, great, do it. If you're the type like me where you're like, I need a little gentle introduction, then I would say progressively getting there. Okay.
Sounds good. The next question is what they can do about chronic fatigue.
Chronic fatigue. So there's 3 things. Number 1, start exercising and eat healthy. That's going to help you. Number 2, and I know that it sounds contraindicated because you're like, well, I'm really tired and I can't exercise. It doesn't mean you have to go climb a mountain or lift weights. It means walking for 10 minutes 3 times a week. Just progressive things to get your body in that cycle. And nutrition, of course. The second thing is if you are having a lot of endometriosis symptoms and you're a lot of pain and discomfort, get that under control.
Okay.
Right? Quality of life is really important. And the third thing is if you have endometriosis, you want to make sure your your iron levels are okay. Because if you're having a lot of heavy bleeding and it's prolonged, like 7 to 10 days with a lot of clotting, you're going to be more anemic. And so you want to get your blood test done to check if you're anemic. If you are, try to get your iron sources through foods more than the supplements, but if you need to, supplementation is okay.
Okay. I had a problem with iron. I had really low iron and I didn't want to do anything. I was so tired all the time. So for sure tackling the iron levels helped me a lot.
Yeah, and when you tackle the iron levels, also remember, remember that if you can get your cycles less intense in terms of pain and the clotting and the heaviness, that's really gonna help your iron levels come up too. So address the cause, but at the same time, that takes a couple months to sort out, like 6 to 9 months. So start the iron supplementation so that when everything improves, you can get off the iron supplement and get it through whole foods.
Okay, thank you. Can you be under hormonal treatment at the same time than a homeopathic treatment?
Yes, you can. We do that with about 60% of our patients. So,
that's good.
40% opt to just do it with what we're doing, and then 60% will do integrative.
Okay. Do you work with other traditional doctors on patients to treat endometriosis?
Yep, always do. Simple rule. I'm good at what I do, but I need surgeons and I need other doctors to be able to help me facilitate what's best for the patient. So definitely we work with a lot of other doctors, and we also work with surgeons and other teams of those involved in endometriosis. So always will.
So how do you recommend approaching your gynecologist about taking homeopathic approach before the surgery rather than taking Lupron or Lisa or other hormonal treatments? And what are your thoughts on the hormonal treatments?
So in terms of the hormonal treatments, I think that if it's the right fit for you, then you need to make that decision. Right? The thing with opinions when it comes to medicine is that it's going to be always biased. So of course I'm going to, there's a tendency for me to go, well, before you do that, try this. And the reason why I prefer the more natural approach is that it does work for a lot more people. It's a lot gentler, and you're not going to be having medications that can really impact your hormonal cycle. At the same time, if that's going to benefit you and it's going to speed up your recovery, great, and you're comfortable with what that's going to do for you, then that should never stop you. It's really about the ability for you as a woman to control your decisions when it comes to your healthcare and not having it enforced on you. And especially with endometriosis, because a lot of it seems to be more isolated in very aggressive treatments with medications that don't always have a great outcome, or it's surgery or hysterectomy, right? And it's like, well, there's a little bit more offering, and that's what I bring in.
Okay, sounds great. I have a few questions about the pill. So can you control endometriosis with the birth control pill? Do they need to take birth control pill so endometriosis doesn't spread more?
So it depends on the birth control pill that you're taking. If you're taking a combination one, which is the most common one that's prescribed out there, you're going to, it depends on you. So what happens with birth control pills is that they're regulating your hormones. They're adding in hormones to change your natural rhythm.
Okay.
If you're adding in the estrogen progesterone, it depends on whether or not inside your uterus you have these receptors. So you have estrogen receptors and progesterone receptors. In some cases with females, and you're one of these in one of these situations, if you have your estrogen receptors are too many of them, the progesterone receptors don't work. Right? So think of it like if you have way too much credit card debt, you don't get to go on vacation.
Yeah.
Right? And so it doesn't matter how much paychecks you get, you need to pay that credit card debt. And that's the estrogen receptors. Okay? The progesterone receptors is having extra cash so you can buy the nice clothes, you can go on vacation, buy a car, buy a house, treat yourself. So when you're taking the combination pills, if the estrogen receptors are too active, then that's when those medications don't work. And in that case, you can take different types of birth control pills and they'll still have a poor outcome simply because you're not able to absorb the progesterone. Okay? So in those situations, if that's happening to you, it's because you have way too much estrogen going on and the medication you're using it's not that it's not strong enough, it's just that the receptor activity is not going to be changed by that, which is where like resveratrol and homeopathy is really helpful because we help improve that balance of receptors.
Okay.
When it comes to whether you should use birth control or not, I personally think, again, if it's working for you and it's giving you a better outcome, that's a lot better option than some of the more aggressive prescriptions out there. And so if you can use that along with homeopathy, and if it's not, and if you don't feel comfortable with it, or it's affecting your moods, or it's giving you negative side effects, then don't. You need to make sure that this is the best decision for your body, not from your doctor.
I know of a lot of girls that reach out to me and saying that they've been 3-4 months into a hormonal treatment or the pill, and they're starting to feel depressed and moody and all of the symptoms, but every time they go back to their doctor, they're told that it takes a few months for it to regulate.
So it takes roughly between 3 to 6 months. But if your moods are being altered and you're getting more depressed, and it's starting to affect not just your quality of life, but it's affecting your ability to function. So your relationships, your family, your friends, your work, that's not acceptable, right? I mean, there's a small window where you can expect to have things take time to improve, right? In terms of, let's say, your cycles, maybe it takes 3 or 6 months. But the fact that we're telling people, it's okay to be more depressed, more anxious, I would say that is probably a warning indicator that medication is not the right fit.
Okay.
And the thing with doctors is, unless you are very well versed in endometriosis, the awareness is really poor within the medical community, whether it's traditional or alternative. It's just people still think of endometriosis as just severe cramps, and it's like. No, there's a lot more to than just its bad cycles, because it affects moods, it affects hormones, it affects the ability to have family planning, right? So fertility is a big issue. It affects your energy levels, and intimacy. It's one of those things that completely encompasses your life. And so you can't have a treatment that's making you worse in terms of your moods, because your mental frame of having hope is going to bring you out more in the forefront of being able to do the lifestyle changes, where if you get more depressed, you're going to push back. So I would say in that case, demand better from your doctor.
Mirena IUD, in general, how can it impact negatively a woman's health?
I think with the IUDs, I think that they have a really good place for endometriosis patients. I think in terms of impacting health, it's more the issue of whether it's the right fit for you. The IUDs have the risk factors of causing bleeding, of causing the uterus to have an accident to where it goes through the uterus. So you got your traditional side effects there. In terms of, is it negative for a woman's health? Again, I think for each woman that is really to their personal decision and whether it fits them or not. So I don't take that off the table. I always leave it as an option.
Okay. Next one, I had a few questions about it. There is a trend with CBD products to alleviate endometriosis pain. What are your thoughts on it? I
think that a CBD product that can help relieve your pain is a lot better than taking a prescription opioid. So I encourage people, the safer route is the better route. At the same time, my concern with managing pain is that you're only managing pain. So one of the key things I want to share with people, whether it's your audience member, yourself, or doctors or nurses, is that managing pain is the first priority. But just because you manage someone's pain doesn't mean that they're getting healthier.
Yeah.
It means you're getting their quality of life back. But endometriosis isn't just about pain, because you can take prescription painkillers or CBD oil and you can feel a lot better around your cycle, which is fine. The problem is you still have that progression of endometriosis. So you need to address the root issue, but if the CBD oil is working for you and it's helping you not go on narcotic medications.
So like CBD products are pretty much the same as Lupron and other hormonal treatments because they're just masking.
Well, they're definitely symptomatic relief.
Okay.
Right?
Yeah.
So you're not going to, from what I know, and I could be mistaken because I'm not very overly educated in CBD benefits. I know that there's some pain alleviation there. I'm not aware of CBD oil causing endometriosis to cure or to regress growth of cells. Because part of the issue with the implants, so you have your uterus and all that tissue is supposed to be there. For some reason, it's now growing outside of the uterus in your pelvic cavity. And so the most common sites it grows on the ovaries, the fallopian tubes, and in some cases the uterus and the rectum can get joined together. The reason why it gets really painful leading up to your cycle, and why it's extremely painful the first 3 to 4 days of your cycle, depending on your severity, is you have these tissues of this uterine tissue. They start bleeding as well, but there's nowhere for the blood to go. So you're taking CBD oil, it's going to take away some of that pain, which is great because quality of life is important. But if you're ignoring the issue, you're going to have that getting worse and worse and worse, and eventually even CBD will not work.
Okay.
So use it as a tool to improve your quality of life, but work hard at it. It's like if you're going to exercise but you eat McDonald's all day long.
Yeah, yeah, definitely. Must endo be scraped out regularly? And your thoughts on excision and ablation on laparoscopy?
So I think, again, I work with a lot of medical doctors, and surgery is one of those tools I think that has a really good place in endometriosis. I also think that it's perhaps a little overdone in some cases. If you are having endometriosis and it's quite spread out, and when they do the exploratory laparoscopy, it is a good idea to get that procedure done. Whether you're getting ablation or you're getting excision, you want to be able to get that done so you can get some of that overabundance of tissue out of there. But remember, even with those treatments, you're still going to have to deal with endometriosis, because there's as much tissue as you take away, you leave a millimeter or half a millimeter tissue, in 5 years that's going to become a concern again. So you can't get rid of all this tissue. But it does improve taking away the massive amount of tissue building up. So that'll improve your quality of life. When it comes to surgery, a lot of the research studies show that when you get surgery done, you feel really well for about a year or two, and then your symptoms by the third to fifth year is back. So there's a question now within the medical community, is like, is the surgery even worth it? Because it's such a short period of relief, and we're not even sure if it's because the surgery worked, or was it just the mind goes, I had surgery, therefore I'm better.
Yeah.
Right? And I think in this case, I would say don't argue about the mind aspect. If you're getting better with it, then it's an option. But again, I think if you do surgery and you combine it with alternative therapies that can further help slow down the progression of endometriosis, then you get benefit. The concern with doing multiple surgeries is you're going to get a lot of scar tissue, and because of endometriosis, you're very sensitive to inflammation. It's not the best thing.
Okay. Yeah, I've heard of cases that they're on their 12th or 13th surgery.
Yeah,
and within just 3 years.
Yeah, and I see that a lot.
And it's just.
And I think in those cases, again, it benefits them, but I really wish that they would add something to their repertoire.
Yeah.
Right. It's
like a way to control it, so it could.
So you can have more time in between.
Yeah.
Right? And the thing with surgery is that it actually also helps if you're having fertility issues and you have like stage 3, stage 4 endometriosis. Removing those adhesions or removing the growth of endometriotic tissue can actually help lessen the inflammation in that area. But again, if you're doing it so often, surgery is I think part of it is that we got sold on the fact that, well, it's just, a couple holes and simple procedure. It's like, well, yeah, it's simple for the doctor who's well versed in it, but your body has to put a lot of effort in recovery, an excessive amount of effort.
When I have a bad flare-up, is there something I can take or do to minimize it?
So when you have a bad flare-up, there are things you can try, like Picanol. If you take it in your PMS phase, a lot of it is going to come down to kind of getting ahead of your cycle. So that might be challenging, because if you're having a bad flare-up and you didn't really take care of it at the premenstrual phase and your cycle's now coming, that's more prescription territory. Because in alternative medicine, we're really about trying to regulate and normalize. We're not about trying to shut down processes.
Okay, so being more proactive.
Way more proactive.
Okay.
Yeah, thank you.
Can a woman get pregnant just with a homeopathic treatment?
That's what we do a lot. So we have a lot of patients who come in for fertility issues. And I would say a good, so about 40% are polycystic ovarian patients, or PCOS patients. The other 40 is for endometriosis. And the remaining 20%, we actually don't know what's wrong with them. Neither does the fertility clinic, but that's kind of the breakdown. So we help a lot of patients have families with just homeopathy, and it works really, really well.
Glad to hear that. Is sex less painful if I take a homeopathic approach?
It definitely improves the level of your ability to enjoy intimacy again with your partner. So yes, homeopathy will help with that. It takes a bit of time. So if you're expecting like after a month or two that it's all gone, 3 to 6 months is the average time for seeing good improvements in your treatment. Some people do better quicker.
I have a person that asks, they have a lot of bladder infections with endometriosis. Is that normal?
So with endometriosis, one of the least talked about symptoms is actually bladder infections, or things that mimic bladder infections. So in this case, it is part of endometriosis, and it's not normal. Simple rule of thumb that I have is that if it's happening frequently and you're starting to go, this seems strange, whether it's bad painful cramps or bowel symptoms or rectal symptoms or intimacy discomfort, like discomfort during intercourse, bladder symptoms qualify as well. So if you're having really painful urination or burning urination that's happening quite frequently, that's not normal. Please take care of that. Before you start antibiotic treatments, make sure you get a urine test done. If there is evidence of a bacterial infection, make sure they culture it to make sure that the antibiotic you're taking is going to kill that bacteria. Because the last thing you want to do with endometriosis, because a lot of these symptoms are going to be not responding to antibiotics. So you can take stuff that's going to ruin your gut, and especially if you're eating healthy and you're doing probiotics and you're working at a healthy gut, you've now killed all that hard work. So don't do that yet. The other thing you may want to do is you may be having a lot of endometriotic growth on your bladder, so you might want to get that checked out, talk to your specialist about it. Is there things you can do naturally for it? Yes, there is. It depends on 2 factors. Are we dealing with an infection? Or are we dealing with something that is more an endometriosis issue with a level of inflammation and tissue growth that's irritating the bladder? If it's an infection, there's, some of the homeopathic medicines are Staphysagra, Merxol, Basilinum, sulfur, pulsatilla, canthus. There's a whole bunch of medicines. D-mannose, which is a supplement, actually helps flush out the bacteria from your bladder. That can help some of the symptoms. In terms of if it's more with endometriosis, then the homeopathy is actually a much better fit for that overall.
Do you recommend acupuncture?
Yes, it is great for helping relieve pain, and tons of studies have shown that. I think acupuncture is one of those things that should be kind of done. Plus, it also helps your backaches go away. So it's like it's like you get better, it's like a massage without
an extra push.
An extra push.
Any recommendations for endo in the bowels?
Yes, so if you have endo in the bowels, you want to find a treatment that can really, really help you with your estrogen levels. And I know this sounds a little bit complicated, but when it comes to your estrogen levels, remember receptors. Hormone balancing is not just about estrogen and progesterone, it's about your body's receptors. So it's about the estrogen and progesterone receptors. The reason why you're going to get endometriosis growing there is because you have a lot more estrogen receptor activity in your colon, and you want to find a way to reduce that. One of the things that helps reduce estrogen receptors and helps with endometriosis in the bowels supplement-wise is resveratrol. There are homeopathic medicines like aloe, hamamelis, and nitric acid, and a few other things that can help. When it's coming in your bowels, find a doctor you can work with who knows their stuff. Don't just find like any doctor. Find one that's really, really well educated in this.
Okay. Can stage 4 be treated with homeopathic, or hysterectomy is my only choice?
Hysterectomy is absolutely the last resort, and staging is interesting in endometriosis because when you have stage 2 or 4, and then there's substages to that. Staging is more to do with the spreading of your endometriotic tissue. Strangely enough, the symptom severity, so if you're having really bad endometriosis symptoms, you can actually have worse symptoms at stage 2 than at stage 4 because it's the location of where you're having these growths. So I would say that if you have stage 4, yeah, that's concerning because it's aggressive, but it doesn't mean hope is lost. If you are having a lot of pain and symptoms, there are ways you can help reduce that. And so if you want, you can still have a window of opportunity where hysterectomy might not need to be done. But again, you have to try a treatment for 6 months, see how it works out. Save hysterectomy for absolutely the last option because it's not just a simple surgery. Sometimes when they do hysterectomy, they'll also take the ovaries out, and then that makes your hormones a little bit harder. And I've seen some patients who've had the surgery done, and their tissue still comes back.
I think I missed one here. Is homeopathic the same as naturopath or holistic?
Oh, no. So that's actually a really good question because that's the most common one. Homeopathy on its own is actually a system medicine. So it's over 200 years old. It originated in Germany. So there was a German doctor who came up with this. And it's now used quite a wide, in Germany it's used, in Switzerland it's used, Belgium, United Kingdom, France. There's a lot of countries that use it. India uses it, Pakistan. Parts of South America actually use homeopathy. So South Africans are very familiar with homeopathy. South Americans as well are very familiar. I didn't know that until I got a chance to meet with you and other individuals from South America. So homeopathy is actually a system of medicine completely on its own. And where naturopathy is more to do with very strict regimens of diet and also avoidance. So it's like, well, there's a tendency to be like this, you can never have this again. Where with homeopathy, we're more inclusive about, look, this is probably not the best fit for you. Alcohol, for example.
Yeah.
Right? It doesn't mean you can never have it again, but it's just you probably should not drink a lot of it because it's going to upset your endometriosis because it does help with the estrogen levels. But as time moves on and you get better, your tolerance level will come up. It just doesn't mean that you go party every Friday night. It just means that on your special occasion, you can have that 2 glasses of wine without the consequences. And naturopaths are also more into more supplements, so and the training is different as well. Homeopathy, just a system medicine on its own. As for the holistic part, holistic is actually part of anything with integrated medicine. And so my argument is we came up with the idea of integrating things. Everyone just copied us.
Any other advice that you would like to give us?
Yeah, I'm not advice. I mean, I think I can get advice from you because I'm not the one who lives with this, right? I can give advice on what not to do and what to do health-wise. But I think having the ability to talk to individuals like yourself, where you're sharing a story and you're building a community and you're giving them support, and the fact that you've taken, I'm really, really grateful that you've taken a huge step forward in letting me have an opportunity to talk to people and answer these questions because our world is really about picking sides nowadays. It's at least it feels like that for me. I could be wrong. And when it comes to medicine, the only advice I have is don't worry about philosophy, worry about yourself and the outcome. In other words, worry about your health and how you're going to get better. And so sometimes that means surgery is going to be needed. Sometimes that means what we do in terms of my treatment with homeopathy and supplements can do a lot better than the harsh prescription medications. Sometimes you need both. The one advice I'd say is don't accept the answer for what it is, push back. So if people are just going, oh, it's in your mind, you as a woman who has to have cycles every month have more than enough right to say this is not acceptable, it's not in my head, this is real, and push for better answers. So be your own advocate, but grow the community, educate each other, and don't pick philosophies, pick what is the best for you at this time.
Great advice. The last one, how can they find you? Social media, or do you work in Canada and the US?
So I live in Canada, in Calgary, as you know. I don't live in the US. Be nice living somewhere warm, you know? So in terms of how you can find me, you can visit me on my website. It's nielsenclinic.com, Nielsen clinic.com. Or you can find me on Instagram. It's vj.nielsen, so vijay.nielsen on there. In terms of phone number, 403-265-9730. Don't want to give my cell. Did that once. That's my office number. So if you're looking for treatment or you're looking for help, always feel free to help. To ask in terms of email address, it's vnielsen@Nielsen Clinic. So V as in Victor, Nielsen, and then at Nielsen Clinic. In terms of do I help people in US? Actually, 40% of my practice is based in America. Mm-hmm. So I do a lot of video consultations. So just like what we're doing now, the difference is we'd be talking one-on-one.
Yeah.
And so yes, so I help patients in US, I help patients in Canada. I've actually had a couple of patients from Mexico.
Oh, wow.
4 endometriosis patients from Mexico. So the good thing about technology is that it's taking away the restrictions on getting care. So that's what I'm saying. Push your way through for your health, because no matter what I can do or what I can say, you have to be able to vouch, you have to be able to fight for yourself. Because when you go to the specialist appointment and they're putting pressure on you going, this is the only option, it's really intimidating because you're depending on someone's care. So don't get intimidated. If you're feeling that it's intimidating, if you're feeling it's a negative environment, find a positive environment, because that's where you're going to thrive.
Well, thank you, Dr. Nielsen.
Thank you.
Thank you for taking the time to answer some of the questions that the ladies sent. And I really appreciate it. I really want to thank you for taking the time.
No, thank you. And thank you for the time. And thanks, everyone. And again, thank you for doing all the hard work and sharing your story. Appreciate that a lot.